Muscles of the larynx. Welcome, vocal adventures. Have you wondered what makes your voice sound stern when you're angry? Or silly when you laugh at a joke? And oh so soothing when you talk to a little child? The maestros of your voice, aka the laryngeal muscles, are the ones responsible for shaping the emotions and tones that color your every word. Pop quiz. The muscles of the larynx can be broadly classified into extrinsic and intrinsic groups. The extrinsic group of muscles lies outside the laryngeal cavity and mainly offers support to the larynx. These are the muscles of the triangles of the neck and the posterior muscles of the tongue. We will learn about them in their respective sessions. On the other hand, the intrinsic group of muscles lies within the laryngeal cavity and can be further divided into the respiratory and phonatory groups. As the name suggests, the respiratory group only assists in respiration by moving the vocal folds apart to let the air in. The posterior arytenoid muscles are the only example of this. They do not play a role in phonation. The phonatory group of intrinsic muscles helps in the production of sound and speech by approximating the vocal folds. These are the lateral cricoarytenoids, transverse arytenoids, oblique arytenoids, cricothyroid, and thyroarytenoids. Now let us study the anatomical details of each of these muscles, starting with the posterior cricoarytenoid muscle. They are small paired muscles that run from the cricoid cartilage to the arytenoid cartilage on the same side. It is important to note that they are the only abductors of the vocal cords. The muscle begins on the posterior surface of the lamina of the cricoid cartilage and is then inserted into the muscular process of the arytenoid cartilage on the same side. The motor supplied to this muscle is from the recurrent laryngeal branch of the vagus nerve. The posterior arytenoids are abductors. On contraction, they rotate the arytenoid cartilages laterally. This action pulls the vocal cords apart, thereby opening the rima glottidis and allowing air to flow into the laryngeal inlet. Next, we move on to the lateral cricoarytenoid muscles. They originate on the lateral part of the cricoid cartilage and insert into the muscular process of the arytenoid cartilage on the same side. They receive their motor supply from the recurrent laryngeal branch of the vagus nerve. They rotate the arytenoid cartilage medially, resulting in the adduction of vocal cords. The result is a narrowing of the rima glottidis. Next up, let's talk about the transverse and oblique arytenoid muscles. Fibers of both of them form one single muscle that passes from the arytenoid cartilage of one side to the arytenoid cartilage of the opposite side. It is important to note that the transverse arytenoid muscle is the only unpaired intrinsic muscle of the larynx. The transverse fibers begin at the posterior surface of the arytenoid cartilage and run transversely across the midline to get inserted into a similar area of the arytenoid cartilage on the opposite side. The oblique fibers have their origins in the muscular process of the arytenoid cartilage and run obliquely across the midline to insert into the apex of the arytenoid cartilage on the opposite side. The crossing of the two oblique muscles forms an X shape behind the transverse muscle. Both muscles receive their motor supply from the recurrent laryngeal branch of the vagus nerve. On contraction, both these muscles cause approximation of the arytenoid cartilages, thus narrowing the airway. The next intrinsic muscle is the cricothyroid muscle. As its name indicates, the muscle begins at the outer surface of the anterior arch of the cricoid cartilage and inserts into the lower border as well as the adjoining inferior horn of the thyroid cartilage. This muscle is a tensor. When it contracts, the thyroid cartilage tilts forward. The vocal cords behind it are therefore stretched and tightened. This action is responsible for producing high-pitched sounds. It is important to note that this is the only intrinsic muscle that is supplied by the superior laryngeal branch of the vagus nerve. Let us now move on to the thyroarytenoid muscle. The upper part of this muscle is also called the vocalis muscle, which is the primary muscle in speech production. It originates from the posterior surface of the thyroid angle and is inserted into the vocal process of the arytenoid cartilage. It receives its motor supply from the recurrent laryngeal branch of the vagus nerve. The thyroarytenoid fibers shorten the vocal folds by pulling the arytenoid cartilage forward towards the thyroid cartilage. The vocalis fibers tense up the vocal cords. Pop quiz. Now that you have understood the importance of the laryngeal muscles in sound production and respiration, let's discuss their clinical significance. Vocal cord nodules are small nodules formed within the vocal cords, commonly seen in singers and teachers. Hence, they are also known as singer's nodules or teacher's nodules. Affected persons may experience hoarseness and fatigue during talking and singing. Resting the voice usually reverses the condition. In some cases, surgical removal of the nodules may be required. Laryngeal paralysis is a condition seen when the nerve supply to the laryngeal muscles is interrupted. In mild cases, only voice and phonation may be affected. In severe cases, like Duchenne's muscular dystrophy, the laryngeal muscles may be completely compromised, resulting in difficulty in breathing. We hope you had fun learning with us.